Welcome in Dr. Michael Saag, infectious disease expert at UAB. He wears a lot of hats at UAB, and I'm too stupid to name them completely and get it correct. But Doctor, thank you so much for joining us. You're one of the rare folks among your field who's not only following the coronavirus, but you battled it and you defeated it. You went through quite the experience, though, for a couple of weeks. Just tell our viewers a little bit about that process you went through.
Well, the punchline is it was pretty horrible. And I was fortunate in that I didn't get sick enough to where I had to go to the hospital. But there were many nights where I was wondering if I was just on the edge of having to call 911 and get carried in. The horror of it, I think, is twofold. One, the symptoms are bad enough, and I think everybody knows what they are by now. But the real problem, at least for me, was that it was a cycle of feeling good in the morning, and then in the evening and at night having pretty bad symptoms. And the horror part of it is not knowing if the next 5 minutes I was going to deteriorate, and just sitting on the edge of wondering all night for 8 nights in a row, just like Groundhog Day, coming same thing until finally on the last day, obviously, it went away. But it's something that I wouldn't wish on my worst enemy. So I hope everybody stays safe and avoids this.
You know, there's so much information out there, data. I'm not going to act like I know what I'm talking about. So that's why I've got you here. And especially when this virus comes and affects sports, because obviously a lot of folks' lives have been affected in a lot of industries, and sports right now is the one that is kind of an escape for everybody to get away from everything. And we don't have that, we don't have that entertainment. And so everybody's wondering, when is it going to be safe to return to sports? But on the college level is so much more interesting to me, because professionally, people live on their own. They're not huddled together. They're not on a campus. But when it comes to college football, for example, student athletes are part of a 30,000 people in a student body. One, is it possible for us to see campuses operating at full capacity, back to quote unquote normal operations in the fall? And to get to that point, just from an academic standpoint and having those classroom settings and functions, what do we have to do to be able to do that and feel safe to do so?
Right. Well, you're exactly right. There's a prerequisite for any college football team, for example, that all of the students need to be back. You can't just say, okay, the rest of you students stay home and only the student athletes come in and participate. So you have what I call a lot of high density living, a lot of high density situations. And you mentioned some, the classroom, the dormitories, the dining halls. And for the athletes, it's true too. The thing that I think is relatively new to my understanding of this virus is that a lot of the transmission appears to be through the lungs, from breath, going from one person to another. So just talking, certainly yelling, singing, that type of thing puts the virus into the air in small droplets, and if somebody's coming by the other way, they can inhale it, and that's all it takes. So with those fundamentals in mind, what we need to be prepared for both the students and the student athletes is trying to minimize the amount of contact to each other without the protection against inhaling these types of things. So I think a simple start would be requiring masks, and I think they're very effective, and we might start with that. But the bottom line is we're going to have to do a lot of frequent testing of both the student body and the student athletes, and that's going to require scaling up platforms that can not only do the testing and get it done, but that the results get fed back quickly.
What are the capabilities of that at this point? We're 2 months into this as far as stateside of this being a pandemic and us really focusing on things as social distancing and isolation, some lockdowns. Has testing increased to a level of which we can get to a point where near the end of the summer, we're able to have increased testing on campuses and, for that matter, start doing contact tracing and things of that like?
We're not there yet, but I think perhaps by August we'll be able to do that. One of the things, not to get too technical, that I hope emerges between now and August is something called an antigen test. And briefly, what that means is that instead of looking for the viral RNA itself that we have to do through something called PCR, where you amplify that RNA, that's what takes so much time and usually a 24-hour turnaround. An antigen test is just the fragment of some of the outer part of the virus that can be used, can be detected from a swab or sometimes just from saliva. And if that test can turn around in really 30 minutes or an hour. So that type of testing is easier to collect and gives you a faster turnaround. It may be a little bit less accurate, but we might trade off a little bit and take that for the other advantages that it presents.
So what has to happen for college football to return and for probably health officials to say, okay, on the local level, state level, to go, okay, you can have football games. I won't even discuss, large gatherings, people in the stands, but actually having football games. What has to happen?
I think first and foremost, we've got to assure the safety of the players, the coaches, and the officials and other people who might be on the field. I think what that's going to require from an epidemiology perspective or standard ID stuff would be the frequent testing and the isolation of people who are infected so that they're not on the field with other players at the time that they're letting virus out into the atmosphere and into the environment. The hardest part, besides all the usual stuff we're going through with this, one of the biggest problems of this virus is that its peak time of transmission is in the 24-hour period before someone has symptoms. So that means feeling fine. I'm in the weight room. I'm working out. I'm, huffing a little bit in the bench pressing or something. And as I push air out, it's going into the environment. The guy spotting me is going to be breathing that in. And I feel fine. It's not till the next day I get sick. The person who was spotting me almost certainly will become infected from that exposure. So what we have to do is be testing people early on and frequently. And when we do, we'll be able to isolate that individual and take them out of the environment where they can infect others.
You talked about what needs to happen for us to get to that situation, but what happens when and if players are allowed to be back on campus, they're training, or even we're in the middle of a season and a player is infected and there's been that time period where we don't know how long he was contagious. So what happens? What do we do?
So I would think that what likely will happen is that, for example, the Friday before a Saturday game, the whole team will have just a test, and that'll include the coaches too, just to see if there's somebody infected. And if they identify that person, they're going to need to pull them out of competition while they monitor them for symptoms and let them clear. If during the week, which is almost likely to happen, somebody gets sick, you pull them out and then you test the other players on the team perhaps to see if they've inadvertently become infected. And that's frankly the best we can do. If we do that, I think we'll minimize the number of people who get sick. I think we'll minimize the amount of time off for a lot of the players. A lot of the concern I think all of us have is not as much for the players. We certainly don't want them to get sick, but it's likely that if you get sick, they're going to survive this. But the coaches, a lot of them are over the age of 45 or 50. We know that the symptoms are worse in that age group. And not only are the symptoms worse, but the likelihood of having a fatal outcome, albeit low, is pretty real. So we want to make sure that we're protecting everyone. But as you said, this is something we all want. I mean, we're sitting at home, we're watching reruns of games from 5 years ago, and kind of interesting. I sometimes can't remember who won, so at least has a little bit of intrigue. But we want to see the real season, and I think we're all pulling for that, and hope we can get it together.
We think of, hey, the football season seems like it's far away, but as I mentioned, when we started kind of getting into this situation here stateside, that was 2 months ago. 2 months from now is what a lot of athletic directors and commissioners have identified as their drop dead date for when players will have to report in order for them to start a season on time. Of course, there's a lot of contingency plans about delaying the season potentially, But between now and say these next 2 months, what kind of advances could we see as far as increase in testing? And also, where do you think we'll be as a country as far as the infection rate? Will it increase? Will it be still dropping, leveling off? There's a lot of factors in this.
So let me break down the answer into two parts. What I'm hoping is happening right now, and I know it's happening with the University of Alabama system, which includes the Tuscaloosa campus, but also UAB and the Birmingham campus. We're working very hard right now to set up the platforms to do the things that I said about testing and tracking and making sure it's safe for students to come back, making sure it's safe for the student athletes not only to come back and play, and make sure that the staff and the coaches are protected as well as faculty. So that's going on at the University of Alabama systems, and I'm hoping that that's happening in the other systems as well. And if we're all on the same page, there's a reasonable chance that we have a shot at having a season. As you said earlier, the stands, I don't have a dog in that fight so much. I know people want to go to the games. I know the institutions would love to have people in the stands for all kinds of reasons, but I think just getting the players on the field safely should be job one, and as well as getting our students back on campus. Now, where is the epidemic going to be in August? Frankly, your guess is as good as mine. We don't know. We've never encountered anything like this. And I think on the internet and on Twitter, you see a lot of badgering of people like me who, when I go on a show like this and I make some declarative statements, we're using knowledge of other viral diseases that are similar to this and then looking forward. So as I do that and looking at what we've seen so far with this virus, I don't see it going anywhere anytime soon. And a lot of it depends on what we do as a country in terms of how well we mitigate. There's a lot of debate, as you know, between stay at home or relaxing stay at home. The economy is suffering mightily. Our friends and colleagues a lot of them are unemployed or furloughed, and it's horrible to see. It's horrible to experience. And we want to get back to work, but we've got to do it in a way slowly and with the proper platforms to support us. But what I see happening now in terms of a little bit of a rush to return, I'm worried that we're going to help the virus out a little bit. I'm worried that we're going to see not a surge in cases, maybe we might, but at least sort of a continuation of this as a kind of a fire that just isn't being put out at all. And so I think it'll be here in August and may well be through the entire season.
You know, everyone talks about 12 to 18 months for a vaccine to be developed. And I'm sure, you know, in your field, that's extraordinary for a vaccine to be developed. From, you know, reading your peers and speaking to others and just your own opinion, do we have a vaccine in 12 to 18 months? I know there's so many folks working on it, but is it realistic to have one done that soon?
If I were to put a nickel down, I'd say no, based on all the other vaccine development that I've ever seen. That said, if we get very, very lucky, and I would underscore that word luck, it's like a Hail Mary throw. It can be caught, and we could do it, but it's going to take a lot of dominoes lining up in the right way for it to be just right and get out there. If it's okay, I'll explain a little bit more about that. So what we do know is that working on other vaccines, let's just take one called respiratory syncytial virus. It's a viral infection of the lung, probably the number one cause of respiratory syndromes in kids. One of the number one reasons that kids get admitted for asthma or croup to the hospital. We've been working on a vaccine for that for 20 years, and it's close, but it's not there yet. And little bitty things keep popping up that keep it from moving forward for widespread implementation. That's because developing a vaccine is really hard. Where we are right now in the field is pretty remarkable when you think we've only known about this virus for 3 months. The genome has been isolated. The area that we want to target has been identified. That target has been put into a vector, which means we can grow it up, and it's already been put into a vaccine that's been tested and in what's called phase 1. So now they're moving into phase 2 within 3 or 4 months. That's unheard of. So it's possible that by the fall we'll have a prototype and be able to look for the final stages of development that actually say, okay, you've got immunity when you give the vaccine, but does that protect? Does that truly protect? And that means you got to give it to a lot of people in situations that are being exposed to the virus and see an effect where the people who got the vaccine don't get the disease, and those who didn't get the vaccine or got a placebo did in numbers large enough in terms of the difference that we can say, yep, it works. That's a tall order, and it has to be safe. So we got a lot to do.
Yeah, in the interim, is there any hope, any promise about therapeutic treatment?
Now that I think is more reasonable and likely, to be honest. So we had this drug called remdesivir that we saw worked some, not a home run, maybe a base hit, but at least we have proof of concept that this virus, like other viruses, when you suppress its replication, you help the immune system clean up the mess, and people don't stay sick as long, and you start to mitigate against death. The remdesivir was given to people late in the course. What we need is a drug like that, except it's oral. Remdesivir is only IV. An oral agent that works like remdesivir that we could give early. So think Tamiflu with influenza, right? If we give it in the first couple of weeks, first couple of days of illness, we knock it out, and then the person sort of doesn't have a bad illness. Those drugs are in development, but they're very early with stay-at-home, testing and contact tracing. Those are just things to buy time. We're going to need therapeutics. I think we'll get that first, and maybe long-term a vaccine. But even if we don't get a vaccine, I'd be happy with a good therapeutic that we could give as an oral therapy and mitigate the symptoms when given early.
Lastly, just your opinion, because everybody's got an opinion on this, but you're more qualified than myself or other writers or anybody involved in sports at this moment. But is there a football season this year? Are we able to get through a 12-game schedule?
Man, I hope so. I would love that. I'm a huge fan of all kinds of football. I played in high school. I think it's a fantastic game. I think there's hope. I know a lot of us are working very hard to try to make it happen at the different institutions. I'm working some with our folks at UAB and through the Alabama system. I'm hoping that's happening. I'm pretty sure that's happening in other places. But to be honest, everything we're doing now is a giant experiment, if we want to be honest about it. We don't know exactly what's going to work. We're just going to have to try it and see what happens. Whatever was going to happen, let's say the season starts, here what I can assure you, this thing's going to be monitored like a hawk. And if we start seeing a spike in cases where, let's say, an outbreak happens on a team and 20, 25 players get sick at the same time, everybody's going to put a pause and we may take a week off. So the likelihood of us getting through the entire season without a hiccup, I'd be very surprised, but I'd love to see us give it a shot.